So the first thing you guys want to do is get your patient set up. So you'll go to view images, you'll click on that, you'll go to your patient, type in DEX for Dexter, and then you go to Dexter Pano. Double click on that to select it, and then you're going to come down here to new exam, and then you're going to go to the panoramic, and then you are going to right click acquire from, and then panoramic. So once you have this box ready to go with the green light, then you basically are ready to go ahead and get started with doing your patient in the room, okay? So then you're going to come into the room, and hold on one second, let me grab gloves.
So you're doing that.
Okay, yeah, you're fine. So we're going to come in here, and one of the things that you have to do first before you do anything else is wipe down the equipment. So you're going to come over here, you're going to wipe down the handlebars where the patient holds on to the bite block because it is not sterilizable. And then you're going to wipe down the forehead and then temple support. Be careful with these little things because they pop off really easily. And earlier today, one of them threw them in the garbage can. So
no.
we don't want to throw it away in the garbage can. And then your on-off switch is over here in the back of the machine as well. So obviously, when you first come in, you would want to make sure that you turn that on because it does take a little bit of time for it to like warm up. So that way it's ready for you to use, okay? So once you go ahead and you put your barrier on, you're going to throw that away. Or sorry, once you go ahead and wipe it down, you're going to put your barrier on. And your barrier is going to be in this drawer. So you take one of these out. And you're going to go ahead and put it on. We're at the end of the roll, so these are not being very user-friendly. Good gracious. Okay, come on. This is slowing down my video. All right, so now I would be ready to go ahead and line up my patient. Okay, so who wants to be my patient? You'll do it? All right, so Alicia. So no, we're not there yet. You remember, you know nothing. You're a patient.
Okay, I know nothing.
Hi, Mrs. Milo. How are you doing today?
Great.
Have you ever had a Pano done before?
No.
Okay, so I am going to, are you lying?
I mean,
You never really have? No.
No,
Seriously,
I
I want to
have.
know if you have. Okay.
No, I have.
So, and it's okay to say that. There's nothing
Okay.
wrong with saying that. So come on, turn around for me. So when you secure this, you don't want to secure it up high like that because then it would interfere and you're going to get an image as we talked about yesterday in lecture. So for this one, we just want it to basically hang right there. Okay, so now what I want you to do is stand right here and I want you to face the machine. Stand up really tall and straight, really tall as possible, okay? So now I'm going to go ahead and I'm going to raise this up to where it's at mouth level with her. So that actually looks pretty good for right now. So then what I want to do, right now I have it in regular mode. What I want to do is I want to put it in test mode. So in order to put it in test mode, you have to push and hold that. That does not allow you to expose the patient. So we're going to do this on her first, and then we'll actually expose it using the Dexter mannequin. So when I line my patient up, some of the things that we need to know about before we take it out of test mode. So I'm going to put it back. So this would be for a child or a pediatric patient, a smaller person. I say a child, pediatric, or an adult who's maybe under 100 pounds. Then this would be for like, say, a normal sized woman. This would be for like a normal sized man, and this is going to be for larger people, okay? So when we go to do the Dexter mannequin, this is the setting that we'll use. But notice how the KBP and the MA increase as you select each one of these. So it jumps up really big time from here to here, and then from there to there, okay? So we're just gonna put it on that one, put it back in test mode. If for some reason, if this one was flashing, that means that it needs to be reset. So either somebody used it before you and they didn't reset it, or you just always need to make sure that you check to make sure that that has been reset, okay? Now, the first instruction that you give the patient before you have them come in, okay? So if you can see yourself in the mirror, do you see the little notches right here? So when I guide you in, you're going to place your upper and your lower teeth into that little notch. First, you're going to hold on to the handlebars, and then you're going to take a step forward until you feel my feet, and then you can put your teeth into the notch, okay? So smile real big for me so I can make sure they're lined up. That actually looks pretty darn good. So now I'm going to have her close her eyes, and we are going to push the button to light up the laser. The laser is going to align right here, if you look mid-sagittal and Frankfurt plane, okay? So mid-sagittal is gonna be the midline, right? So what I do is I look here in the mirror and I say, okay, smile, and her 2 teeth are lined up, but notice how her nose is not lined up. That just means that her nose is crooked. It doesn't mean her head is crooked. So sometimes what you have to do is you would have, like if you notice that their head was turned, that's one thing. But if their head isn't turned and it looks like it's straight, but the nose and the forehead isn't lining up, that's okay. What we're taking a picture of is her teeth, so that's fine. So Frankfurt plane, mid-sagittal looks good there. So Frankfurt plane is going to be this area right here, just below the eyeball and just above the tragus of the ear. Her chin is up too high. So what I want to do is I'm going to just ask her, I'm going to move the machine and just allow your chin to kind of move down, okay? So we're going to adjust that down. Okay, that actually looks pretty darn good now. So just above the tragus of the ear, just below the soft tissue of the eye, okay? So I can go ahead and turn that laser off now. Do not forget to do that. Everybody tends to want to forget to do that. Next thing, we need to close these so that way it secures her head in place. So again, you're looking as you're doing it in the mirror so you can see it. So this closes it, this opens it, this closes it, this opens it. The one big difference between test mode and the regular mode, if you were exposing the patient, these automatically open up after you're done taking the exposure. When we're in test mode, you have to physically come back in and open these up before you can release the patient out of the machine. Go ahead and stop there.